Good day. My name is David Madrid. This is my sister-in-law, Carmela Torres. She was the patient. She is the patient. She had come here to Cancun, to the hospital, to see Dr. Montecon at the hospital Galenia, for the reason that she had surgery done previously, almost a year and 9 months. The results were not what we wanted. Before she had surgery, she had pain in her legs, pain in her back. We saw a doctor in Belize to fix these problems. They weren't fixed, so we sought the professional help of Dr. Montecon. Upon our arrival here, Carmela was approximately less than 50% activities, as it would go to walking. She couldn't bend over. She had multiple problems from her previous surgery. So not only were we here to get a consultation, but to see if Dr. Montecon could possibly fix what the other physician had done, as well as correct the problems that she was encountering now. After seeing Dr. Montecon, he was very personable. As you people probably know, that the doctors get paid by the minutes. This Dr. Montecon, he took the extra time to answer all of her questions to make her feel at ease. She had multiple questions. He took his time. He had illustrations. He had cervical spine so that he could try to explain to her the process that needed to be done. At that time, we were thinking about getting it done by 2 American doctors. Upon our return, to be quite honest, the American doctors that they consulted were not that enthusiastic about if they could even help her, or whether it would be a good thing for them to do surgery on her. We then contacted Dr. Montecon. He told us, very encouraging, that he could at least guarantee that she would not be worse off than she started, which was a huge improvement. So after consulting with her parents, her sisters, and myself, she had decided that she would come here to the hospital and have Dr. Montecon do the surgery. Surgery lasted approximately 4.5 to 5 hours. She came out of surgery very good, in our opinion. Of course, she slept for a day. The very next day, she was barely up on her feet. But to our amaze, pain was gone and she was standing. Before she entered, she had tremors where she would shake uncontrollably. She had limited mobility. Now, after the surgery, she had better mobility. The tremors had to cease. The pain had to cease. Most of the tingling was gone. Within 3 days of the hospital, she was up and about. She was discharged on the 4th day. She had 21 staples placed in her back. She was relatively pain-free. So she was well on her road to recovery, although we were a little skeptical. So on the 6th day, we decided to put her really to see the results of the doctor and what the hospital had done for her. In the morning, she had walked 1.9 miles without any tremors, without any pain. She walked in a normal walk, where she could not walk normally before. She would appear to have epilepsy seizures as she walked. All these had dissipated. That afternoon, we also walked another mile. Of course, she was tired from her surgery, and physically she was unable to recuperate as far as energy-wise, but she showed all the symptoms of on her way to getting a complete recovery. Upon this, we had text Dr. Montecon to express our sincere thanks for his professionalism and for his skills as a surgeon. Because you have to remember, it just wasn't a patient going in that had a problem. This was a patient going in who had not only a problem, but that a previous doctor had complicated. Dr. Montecon not only took care of the complications, but also went further and did the surgery not only on the area that was indicated previously, but he had found that there were several areas that he had to do surgery on. He did them successfully. Now she is post 18 days. She's in very little pain. She will have a scar. That's normal for this type of surgery. But it's a scar that will tell us and tell her family that when you go through this type of trauma, that scar will leave an enduring fact that somebody actually did a fantastic surgery. And every time she looks at that scar, it's not a reminder that it's a scar. It's a reminder of what was done and how it could have an impact on her life. Because for you that have this problem, you know what I'm talking about. You that don't have this problem, you have no idea. What this young lady went through was tragic, and literally she could have been a paraplegic. But now, thanks to Dr. Montecone and the professional services of the staff, the administrative staff, the laboratory technicians, the nurses, we cannot express our gratitude. And if the things make easier when you go to a foreign country or you come into a foreign institute, it's always good to have a liaison, a person who's in the middle who can guide you and really take you by the hand and make your experience a wonderful experience. So we have to personally thank Olivia here at the hospital for making our stay here one of the success stories. The big success is the surgery, but when you look at the total package, they have it here, and we're very, very grateful.
Thank you.